If you want to learn everything you need to know as a nurse about metabolic acidosis, then this is the video for you. Metabolic acidosis is a potentially life-threatening acid-base imbalance that occurs as a result of another condition. It is characterized by an arterial blood pH less than 7.35 and bicarb less than 22 milliequivalents per liter. The body is constantly trying to maintain normal blood pH. Hydrogen and acidic ion and bicarb and alkaline or basic ion are important ions involved in blood pH regulation. When acids are secreted by cells, hydrogen concentrations in the bloodstream increase. This is because hydrogen is a byproduct of acid production. Bicarb is important for buffering hydrogen. The two bind to each other, creating carbonic acid, and then separate into water and carbon dioxide. Proteins also bind to hydrogen in the bloodstream to maintain blood pH. As bicarb and proteins in the blood become depleted, blood pH begins to decrease. This stimulates the respiratory system to increase the rate and depth of respirations. This breathing pattern, known as Cosmos respirations, causes carbon dioxide to be blown off, and therefore blood concentrations to decrease. This increases the ability of hydrogen to bind to bicarb. The kidneys are also stimulated by a drop in pH. This causes them to excrete hydrogen and reabsorb bicarb and sodium. Additionally, excess hydrogen is shifted into cells in exchange for potassium to regulate blood pH. However, this can result in hyperkalemia. If you want to learn more about hyperkalemia, then click the link on screen or in the description down below. And finally, if bicarb loss is the cause of metabolic acidosis, the kidneys are stimulated to reabsorb an equal amount of chloride, a weak alkaline ion, for every bicarb lost to regulate blood pH. This type of acidosis is called hyperchloremic metabolic acidosis. Metabolic acidosis caused by increased acid production includes any illness that results in metabolic activities in the absence of glucose or oxygen. Ketone bodies are produced when the body turns to fatty acids for energy when glucose is exhausted. This includes diabetic ketoacidosis, chronic alcoholism, and severe infections. Lactic acid is produced when oxygen demand is greater than oxygen supply, resulting in anaerobic metabolism. This includes heart failure, pulmonary disease, and seizures. Metabolic acidosis caused by a decrease in excretion or breakdown of acids is usually a result of kidney and liver dysfunction. This includes renal tubular acidosis, liver cirrhosis, and acetazolamide, a potassium-sparing diuretic which decreases carbonic acid breakdown. Metabolic acidosis caused by poisoning from ingesting acids includes ethylene glycol, found in antifreeze and solvents, methanol, found in plastics and industrial adhesives, and salicylates, such as aspirin. And finally, metabolic acidosis caused by a loss of bicarb is usually a result of the gastrointestinal tract, or kidneys. This includes diarrhea, intestinal malabsorption, and chronic kidney disease. Metabolic acidosis mainly causes neurological, cardiac, and respiratory signs and symptoms. Neurological and cardiac signs and symptoms are mainly due to alterations in potassium, sodium, and calcium levels. This alteration in electrolytes causes decreased excitability of nerve cells, resulting in a decreased level of consciousness and muscle tone. Cardiac signs and symptoms include tachycardia, palpitations, life-threatening arrhythmias, and hypotension. Respiratory signs and symptoms include Cosmos respirations. And finally, a dull headache may be present due to cerebral vasodilation, a result of acidic blood pH. Other signs and symptoms that may present are due to the cause of metabolic acidosis. Diagnosis of metabolic acidosis is based on lab results. The most important lab test to diagnose metabolic acidosis is an arterial blood gas, also known as an ABG. The second most important lab test is anion gap, as it can determine whether the cause of metabolic acidosis is due to increased acid secretion or a loss of bicarb. If anion gap is greater than 12 milliequivalents per liter, metabolic acidosis is a result of increased acid secretion. However, if anion gap is normal, between 4 to 12 milliequivalents per liter, then it is a result of bicarb loss. If you want to learn more about anion gap, then click the link on screen or in the description down below. Other tests that are completed are to determine the cause of metabolic acidosis and to assess for complications such as hyperkalemia. Treatment of metabolic acidosis is mainly focused on treating the cause, complications such as hyperkalemia, and providing supportive care. Metabolic acidosis usually resolves when the cause is treated, and oftentimes no other intervention is needed. In severe cases, when blood pH drops to 7 or less, bicarb may be given, either direct intravenous push or as an intravenous infusion. It is important to note that bicarb has the ability to inactivate many drugs and can cause precipitation in intravenous tubing, so flushing well between drugs with a compatible solution such as normal saline is important. This wraps up everything you need to know as a nurse about metabolic acidosis. I hope you found this video useful, and if you did, please show your support by giving this video a thumbs up, subscribe, and hit that notification bell so you never miss a video. And please leave a comment down below if you have any video requests. Thank you, and bye!